All right. Hello, everybody. Um, Today, what I'm going to talk about is why do we have these stars, these millionaires, multimillionaires, billionaires, with mental health issues that continue to be out of control? Like, I'm not going to name names, but you guys know who's been in the news, somebody that's very prominent. Um, and he's popular in the rap world, and his wife has got a popular TV show. And the thing is that they have all the resources in the world, and why is it that the mental health keeps coming into play and causing this person problems? And not only that, but could be influencing a lot of young people that don't understand that this person's mentally ill. I think the adults understand that this person is mentally ill. I would say adults like over 45 understand this person's mentally ill, but I would say that some of the millennials that I've talked to don't really understand that this person's mentally ill. So, why is it that this person seems to get well, and then it seems that, um, it seems that he's going out of control, and that people don't really understand how to manage him. And hello, everybody. I'm giving my Facebook Live today, and I decided to just kind of look at what's going on in the world, the current events. And this is Black Mental Health Month, but I'm still talking about mental health. I think one of the months, a few months ago or a couple months ago, was mental health. So I thought it was interesting that we have some current events that are relevant, talking about mental health in our community. And this is relevant to everybody because, I'm talking about a certain person right now, but there's also some white Americans, some other folks that are having some mental health problems that are prominent right now. But this one, I used to live in Chicago, and this person that I'm talking about today used to live in Chicago. I think he grew up in Chicago. And people tried to blame it on different things that happened in his life, but he's had quite a number of issues in public with his mental health. So what's going on? People are saying that he's not taking his medications. Well, what we need to understand is that not 100% of the behavior, not 100% of what's going wrong with this person is due to a lack of medication. There are a lot of people that have mental health problems right now, and it's not a lack of medication. We need to look at other lifestyle issues and figure out what it is that's contributing to the person being ill. So one of the things that I've talked about often here, and you heard me talk about in the Mental Health Month, is leaky gut. We have an epidemic of leaky gut in our country, and that's because there are things in our food that are contributing to leaky gut. Now, some of you are going to say, oh, well, I eat organic all the time. Well, organic food is probably the best that you can get. I would say the best that you can get is growing it yourself. But organic food is probably a second best. And the thing that you may not realize is that there are a lot of pesticides that are in use, and the runoff water can contaminate or get taken up by the plants that are being grown organically. runoff can affect crops that are in the next farm or acres away. Because what runoff is when it rains, you see the water running off the land and you see it running into gutters. Well, if you had a farm, the water would be running into crevices, getting into the groundwater for one thing, which is shared by the land, and then also running downhill and running into other people's plots and farms. So one of the big contributors to the pesticide problem is Roundup. And you've seen in the media, you've seen it's called glyphosate, and you've seen that people have sued Monsanto about developing cancer after consuming certain amounts of this pesticide. Well, they found that in the cord blood of fetuses or newborns, that there are hundreds of chemicals in their bodies. And that's because we all have hundreds, if not thousands, of chemicals that we're interacting with every day. And we kind of blow them off in this country. But it's significant and can cause significant problems inside of our bodies with a lot of different processes. And also inside of our bodies, certain ones of them are persistent. And what that means is your body can't get rid of it. It may exist in the fat, and it's hard to get things that are fat soluble to leave the body. The fat soluble things can gather up in different organs and also in the fat, in the subcutaneous fat. So this is a complicated problem. But the leaky gut, what happens is that we have a bunch of bacteria, viruses, and yeasts that normally live in our digestive system. So anywhere from the mouth to the anus, like for instance, your tongue and your mouth, you have a lot of different microbes that live there. And these microbes that are in the digestive system not only help with digestion, but they help with the absorption of nutrients. They help with getting vitamins and minerals inside of the body. And they also produce some of our hormones or our hormone precursors or the first step of the hormone. So, and this is also true for neurotransmitters. And why am I talking about hormones and neurotransmitters? Well, hormones and neurotransmitters are proteins, and these proteins are key to communication inside of our body. And hi, thanks for joining anybody that's on. I am recording this, so I hope to post it on YouTube later today. And I just thank you for joining, and please check out my series on YouTube. It's called Treat Yourself to Health. And I also have an Instagram page called Treat Yourself to Health. So anyways, I was talking about the bipolar disorder out of control that one of our stars is having right now. And his wife was yesterday asking on Instagram and on Facebook for people to have empathy and to give them some space. And, you know, people are talking about why is it that this person continues to be out of control? The diagnosis is known. Like, if you take medication, won't the illness stay under control? The answer is no, because most of the illness is not due to some genetic factor. Most of the illness is due to other lifestyle factors. And I've been talking about leaky gut. You've heard me talking about leaky gut in reference to COVID. You've heard me talk about leaky gut in reference to mental health issues that I talked about a couple of months ago. So, so back on talking about the microbiome, which is the microbes that exist inside of the digestive system. And, you know, those microbes are directly responsible for production of hormones and production of neurotransmitters. And what I was saying is that these hormones and neurotransmitters are um, proteins or peptides that help in our communication inside of the body. And when I talk about communication, that means that inside of your body, there are ways that your body organs and systems talk to each other. And neurotransmitters have roles in talking to all the organs, but I think the main role that we think about is the nerve cells talking to each other. So your nervous system includes the nerves in your arms and legs. It also includes big nerves that come out of the spine, and your spinal cord is a big nerve or bundle of nerves. And then all that feeds into your brain, which is the central part of the nervous system and coordinates everything. So imagine that if you're eating foods that are causing you to have an imbalance in your microbes in the gut, which is the majority of Americans, because we have a lot of processed foods and we have a lot of genetically modified foods, and those are contributing to disorder in our digestive system. So imagine that if you have a food that's upsetting that more than other foods, because we can have food sensitivities that can just disrupt the whole order of things and the whole system, the whole balance in just minutes. And we may not feel anything for certain days, for a certain number of days, but I don't want to say that, because in the patients that I take care of, they just lack awareness that they're having a reaction. For instance, they may not be able to sleep for several days or not sleep well, and their sleep may be interrupted. And they would never think to attribute that to what they ate. Or they think, okay, maybe that's affecting me for one day, but they don't know why it's affecting them for multiple days. And then you have stress, which you've heard me talk a lot about. And stress can disrupt that balance of the microbes in the gut too. So think about that. If you are disrupting the microbes that are influencing the balance of the neurotransmitters, because they're making neurotransmitters, which are these chemicals or peptides or proteins that are the communicators in the nervous system. And so that contributes to a brain chemistry that's unstable. That contributes to a brain chemistry that may be what I call irritable. So an irritable brain chemistry is going to result in things like anxiety, depression, bipolar disorder, a number of manifestations or a number of ways that your brain is showing that it's inflamed. And brain inflammation does not go away in one day. Brain inflammation takes a coordinated effort of getting rid of inflammation, and it tends to be the last organ where the inflammation leaves. So, and then if you're doing things, or because we just talked about sleep, that's one of the things. We just talked about stress. That's another influence. We talked about nutrition and chemicals in the food and pesticides in the food. So you can see that there is quite a list, and I'm not even bringing up but I need to bring up infectious disease like COVID. COVID is causing people to have inflamed brain, inflamed nervous system that may not resolve or go away. Um, Epstein-Barr virus is another good example, and cytomegalovirus, another good example, and Lyme disease, all good examples of microbes that you may encounter in everyday life that may influence the balance of the microbiome inside of the body, or the balance of microbes inside of the body may be disrupted by these organisms. And these organisms can cause a lot of inflammation in many organs, including the brain. So I think where people get confused also about brain inflammation is that, like when someone has Alzheimer's or Parkinson's disease, we know that that's a certain specific type of brain inflammation. What many of us get confused about is that we think that something happened to go inside the body and cause inflammation just in the brain and left everything else alone. No, this is not the case. We're finding that with Alzheimer's, for example, we call it type 3 diabetes in functional medicine because people that have diabetes, people that have poor insulin control inside their bodies, and therefore chronic inflammation, many of these people are more susceptible or predisposed to get Alzheimer's. And it's not just the people that are diagnosed with diabetes, but we have many people that have insulin resistance for different reasons and chronic inflammation. And your body sees that as a diabetes state, but you may not have been diagnosed with diabetes. And there are other tests that can be done on the blood that that the primary care doctors generally are not running because the insurance company won't pay for them. So the only way to find out is for you to see a doctor like me who is looking specifically for signs of inflammation. So, and a doctor like me is an integrative or functional medicine doctor. There are other names like personalized medicine, like anti-aging and regenerative medicine. There are many subspecialties of integrative medicine or holistic medicine. And I am boarded in integrative medicine and functional medicine. And I'm boarded in physical medicine and rehab. I used to be boarded in internal medicine, so I did 2 residencies. And I take care of people online. I do telemedicine. You'll soon be able to find me on one of these big platforms across the country. And you'll find me under physical medicine and rehab because they don't have a classification for holistic medicine. However, in my private practice, I do holistic medicine and integrative medicine and functional medicine. So you can contact my practice at here on Facebook. And you can also contact my practice on my website. It's called Treat Yourself to Health. And you can hit the orientation tab, and that will provide your information to me, and I'll get in contact with you. So what can the star that has bipolar, what can his family do, and what can his doctors do? Well, if they don't have already, they should get someone for him that is a holistic practitioner. Now, it sounds like he has a good psychiatrist. However, we do have people that we work with who are more open to holistic medicine. And because certain people, I have seen people in my practice with bipolar disorder totally wean off of medications with the help of a psychiatrist. I have seen people in my practice who had severe depression, severe anxiety, perhaps be managed with just 1 medication instead of 3. Perhaps when they are able to better figure out like what the driving factors are for the mental illness. And this is a whole nother talk. Maybe I'll talk about it next week, but there are a number of methods that are not talk therapy that can help get to the root cause of why the person has the mental illness. Many times people had some kind of adverse childhood experience, and that does not necessarily have to be like abuse. It could have been that they observed something happening. It could have been a separation or a divorce of their parents, something that traumatized a child mentally, and has stuck with them and caused some kind of negative coping mechanisms that turn into mental illness. So people also have experiences in adulthood that cause trauma, like, and you've heard me talking about PTSD. And many of us are suffering right now from trauma, from seeing and stress from seeing too much graphic detail on television. Also from fear about what's going on with COVID and stress. The combined COVID, the combined protests and Black Lives Matters movement, seeing things on TV, seeing people, you know, being captured like animals this past week in Oregon. So there are a number of things that are upsetting people, and people can develop bad coping mechanisms. As a mechanism of survival, it helps the person to survive, but then when their body holds on to those stressors, it becomes a bad adaptation. So what we're going to do, I'm going to end this talk, and let me just see. I'm going to see if anybody is currently, I don't see anyone currently, let's see. I don't see anybody currently watching. However, I might not be seeing the whole story here because they changed the format, which I finally figured out. But if you have any questions, please just post it in the chat, and I'll be coming in here later on today, and I will answer your questions. And if you have a mental illness that's poorly controlled, I would recommend that you try to get a hold of some holistic practitioners like myself, and you need to make a team with your psychiatrist and with your psychologist. Maybe next week I'll talk about some of the methods that I'm familiar with, like tapping, like neuro-emotional technique, that may help you to get at the root cause of the mental illness. All right. I'm so glad you could join me today, and I look forward to corresponding with you in the future. And I hope you have a great afternoon and a great weekend. Thanks so much for joining me. Just a plug for my YouTube page again. My YouTube page is called Treat Yourself to Health. My Instagram is called Treat Yourself to Health. My web page is called treatyourselftohealth.com. And I look forward to speaking with you soon. You can also message me on Facebook, and I'll get back to you on Facebook. You can send your contact information to me on my website by clicking on orientation. And on YouTube, please subscribe and hit the bell so you'll be notified when I post new things. All righty. Take care. Thanks for joining me here. Bye-bye.